Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today we are going to talk about Salmonella, a genus of bacteria that is a major cause of foodborne illness globally. This video aims to provide a detailed look at Salmonella, including its history, microbiology, transmission, clinical manifestations, treatment, and prevention strategies. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's go to the video. Daniel Elmer Salmon, a veterinary pathologist who was instrumental in the late 19th century discovery of Salmonella, is honored by the name Salmonella. More than 2,500 different serotypes of this bacteria have been found by researchers over time, underscoring both its diversity and the difficulty in controlling its effects on public health. Because Salmonella infections can result in serious illness and death, both medical professionals and researchers need to pay close attention to this important topic. Microbiology and classification. Because of their flagella, Salmonella bacteria have a rod-like form, are gram-negative, and are motile. Salmonella enterica and Salmonella bongori are the two primary species that make up the Enterobacteriaceae family. 6 subspecies and several serotypes of S. enterica are further subdivided. Among the most prevalent and clinically relevant are S. typhimurium and S. enteritidis. These bacteria may live in a variety of habitats, including the intestines of humans and animals, since they are facultative anaerobes, which means they can exist with or without oxygen. Transmission and infection. Generally, consuming tainted food or drink is how Salmonella is spread. Undercooked chicken, eggs, dairy goods, and produce are common sources. Contact with contaminated animals or their surroundings can potentially result in the spread of the bacteria. Particularly known Salmonella carriers are reptiles and amphibians, which can either directly or indirectly infect humans. Salmonella enters the body through the food and infects intestinal cells, triggering an inflammatory reaction that results in symptoms including fever, diarrhea, and cramping in the abdomen. The bacteria attach themselves to and penetrate the intestinal epithelial cells, setting off a series of immunological reactions. Diarrhea and fluid secretion result from this invasion of the intestinal lining, which interferes with its normal function. Clinical manifestations. A Salmonella infection can manifest itself clinically in a variety of ways. Gastroenteritis is the most prevalent type, which is characterized by fever, vomiting, diarrhea, and abdominal pain. These symptoms can linger for up to a week and often show up 6 to 72 hours after exposure. In more severe cases, the infection can migrate outside of the intestines and result in systemic infections, including septicemia. This is particularly true for susceptible groups like the elderly, small children, and immunocompromised people. Typhoid fever is another type of Salmonella infection that is brought on by S. typhi and S. paratyphi. Typhoid fever is more serious and, if left untreated, can be fatal. Abdominal pain, a persistent fever, and occasionally a rash are the symptoms. This type of illness is more prevalent in underdeveloped nations with inadequate access to clean water and sanitary conditions. Reactive arthritis, bacteremia, bacteria entering the bloodstream, and dehydration are among the complications that can arise from Salmonella infections. In extreme situations, the bacteria can cause life-threatening illnesses by infecting vital organs like the heart, bones, and nervous system. Diagnosis. Stool cultures are commonly used in the diagnosis of Salmonella infection because they can detect the bacterium. Blood cultures could be required in cases of systemic infection. The speed and precision of detection have increased with the use of rapid diagnostic techniques like polymerase chain reaction, PCR, and enzyme-linked immunosorbent assays, ELISA. Serotyping isolates of Salmonella can yield more details about the particular strain, which is helpful for tracking epidemics and epidemiological research. Treatment and management. The majority of Salmonella gastroenteritis cases are self-limiting and go away with supportive care alone. It's important to stay hydrated because diarrhea can cause severe fluid loss. It is frequently advised to use oral rehydration solutions, ORS, to replace lost electrolytes and fluids. Antibiotics like ciprofloxacin, azithromycin, or ceftriaxone may be recommended in severe cases or when the infection spreads outside of the intestines. Treatment attempts are made more difficult by the rise of Salmonella strains that are resistant to antibiotics as a result of the overuse of antibiotics. Multi-drug resistant, MDR, types of bacteria present serious therapeutic issues, contributing to the growing concern over antibiotic resistance. Encouraging the prudent use of antibiotics in both human medicine and agriculture is one way to monitor and reduce antibiotic resistance. Epidemiology and public health. A major global public health concern, Salmonella is recorded in millions of cases every year. Salmonella is thought to be responsible for over 1.35 million infections, 26,500 hospital admissions, and 420 fatalities in the U.S. annually. These figures are reported by the Centers for Disease Control and Prevention, CDC. Because of poor food safety and sanitation standards, infection rates are frequently greater in developing nations. Public education, epidemic investigation, and surveillance are some of the public health tactics used to tackle Salmonella. The prevalence and dispersion of Salmonella infections are monitored by surveillance systems, which aid in locating the cause and putting preventative measures in place. To stop the spread and stop new cases during an outbreak, quick thinking and action are essential. International health authorities, including the World Health Organization, WHO, work with national health departments to create protocols. They also offer assistance in controlling Salmonella epidemics. Increasing laboratory capacity for diagnosis and surveillance is one of these initiatives. Other efforts include raising standards for food safety and encouraging research into vaccines and novel treatments. Prevention and control. An interdisciplinary strategy involving appropriate food handling, cooking, and hygiene habits is necessary to prevent Salmonella infection. Important suggestions consist of 1. Cook food thoroughly. To ensure that any Salmonella bacteria are killed, make sure that eggs, meat, and poultry are cooked to safe temperatures. Make sure the fowl achieves an internal temperature of at least 165 degrees F, 74 degrees Celsius, by using a food thermometer. 2. Avoid cross-contamination. Keep raw meat and ready-to-eat meals on different cutting boards and utensils. To stop the transmission of bacteria, properly wash your hands and any surfaces you handle raw materials on. Practice good hand hygiene. Hands should always be washed with soap and water before handling food, after using the restroom, and after coming into touch with animals. In places like daycare centers and medical facilities, hand cleanliness is quite crucial. 4. Proper food storage. Avoid eating food that has been left out at room temperature for a long time, and keep perishable items chilled. Make sure the temperature on refrigerators is 40 degrees F, 4 degrees Celsius, or lower. The food business is essential in preventing Salmonella contamination in addition to these measures. This entails putting strict safety measures in place from the farm to the table, such as testing and monitoring for contamination, keeping facilities clean, and abiding by legal requirements. To guarantee the safety of the food supply, food safety authorities create rules and regulations. Examples of these authorities include the European Food Safety Authority, EFSA, and the Food and Drug Administration, FDA, in the United States. It is imperative that these guidelines are followed in order to stop Salmonella epidemics. Salmonella is still a major public health concern, but its effects can be lessened by sustained study, awareness campaigns, and observance of good food safety procedures. It is essential to comprehend the biology, spread, and control of Salmonella in order to safeguard public health and guarantee the security of our food supply. We get closer to lessening the impact of this persistent infection as our knowledge and technologies grow. By working together, the public, governments, researchers, and health professionals may significantly improve the prevention and management of Salmonella infections. In order to reduce the risk of Salmonella in the future, we must promote a culture of food safety and continue funding research. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.